Welcome back. Well, February is Health Month, and we're going to kick this section off with Health Talks brought to you by Baptist Health Lexington.
The advanced cardiac imaging not only helps us in identifying risk, but it also helps us identify coronary artery disease correctly in a population that's pretty challenging. So it's really important that the imaging that we use is tailored to the patient's body habitus, their gender, and of course the likelihood of their having coronary artery disease even before you start the test. What I do is to rely on other risk markers that we know have additive benefit to standard traditional risk markers. And one of them, of course, I use fairly often is one that's called aortic stiffness, which is a non-invasive device that takes a look at the waveform of the blood pressure from the artery in the arm. Based upon the waveform of that artery, we can actually go ahead and derive a blood pressure at the aorta, which can also tell us what the stiffness of the aorta is. What's also interesting is that it also gives us a vascular age. And what the vascular age does is can really motivate a patient, particularly if they find themselves being much higher in terms of their vascular age compared to their chronologic age. We find that to be a very, very powerful motivator for patients. This is a partnership. I feel like I'm a partner with my patients, and anything I can do to help motivate and help them is what we're here for.
Well, that's good information, and we're lucky enough to have my next guest, Dr. Atul Chugh, who's just back from vacation and is willing to just come in and give us a little information. Now, the video you just had there, what's that practically mean to a patient when they hear their vascular age? How do they get younger?
Well, and that's a great question. I mean, I think one of the things that we've been working on with vascular age is to have something that's more tenable to a patient. When I tell someone that their LDL is 184, this is an esoteric number. It's a number that most patients really can't get their hands around. On the other hand, if I tell them that their vascular age is a certain number, whether it be lower or higher than their chronologic age, that gives them a little bit more of an idea of what really needs to happen. And the things that we can do to really change vascular health are certainly things, if one is a hypertensive, for instance, if they already have high blood pressure. What we can do is change some of the medications around so that it helps the vascular function get better. Some medications work better than others. Cardiovascular fitness, things like exercise.
And it's never too late to do that.
No, it's never too late. In fact, more recent data now suggests that even patients who are in sort of that end stage vascular stiffness portion can make differences with exercise alone.
Now, if we're trying to do some evaluation, we've talked about preventions and exercise and controlling cholesterol and blood pressure, but there's ways to find out cardiovascular health that are new, exciting, and less invasive. Tell us about some of those.
And that's really the point, is that in the current era, we can use more than just blood pressure and cholesterol to help us really gauge what someone's risk is. One of the tests that we use often is a calcium score, a coronary calcium score more specifically. That's to sort of say how much calcium there is in the blood vessels that supply the heart. Those blood vessels, if they do have calcium, means that they have plaque in them already. And so what we can do is, if someone's on the fence, for instance, for taking a medication called a statin, which decreases the cholesterol, we can use the calcium score as a means of telling us whether or not that would sort of tip the scales towards starting the statin, or just saying, well, maybe we should go ahead and hold off. The aortic stiffness is also, or the vascular stiffness more precisely, is another one of those new measurements or tests that we use to sort of help us figure out whether or not a patient can benefit from more aggressive preventive therapies like statins that we talked about, more aggressive blood pressure control, more aggressive dietary changes. In my clinic, I have a dietitian that works with me, so that if I do think that a patient can really benefit from more for salt reduction and really needs to sort of pin down those strategies on how to really do that, right there the dietitian will work with the patient immediately right after seeing me in that clinic.
And you can actually look at the heart in is it ultrasound 3D, so you get a good picture without putting dye or something in.
Oh, absolutely. And that's the beauty of more advanced imaging, is that we can do this with little or no damage to end organs. In other words, dyes in the past used to cause damage to the kidneys potentially, and can be quite cumbersome. The vast majority of the newer testing that we do at this point really does allow us to do that without the use of any dyes or any harm to the patient.
And you also have less invasive ways to evaluate the heart, but you also have less invasive ways to treat the heart. And you were telling me about it. It's a new way to treat mitral valve disease.
Yeah, and that's what we're really excited about. In fact, we just did a case this morning. We have a team of physicians. We have Dr. Paula Hollingsworth, Dr. Michael Rakavina, and Dr. Mohammed Nam, and I, all four of us are part of the MitraClip team. It's a very exciting new therapy where we can go ahead and fix a valve called the mitral valve without having to open up the chest. Now, the mitral valve is a very important valve that sits on the left side of the heart. It connects the top part of the left heart to the bottom part of the left heart. The left ventricle, which is the bottom part of the heart, is the real powerhouse of the heart. It's what gives the blood to the brain, the arms, the legs, the kidneys, all the organs in the body. And if that valve above it is leaky, of course, that blood can't get to those vital organs. And as a result of it, what we are then left with is a patient who diminishes in terms of their ability to really be active. Their lifestyle changes dramatically. And rather than opening up the heart, what we can now do is place this clip about 15 millimeters in size, which is about 1.5 inches, and clip the area of the valve that really is the culprit of causing that valve to be leaky. It has been validated quite well in clinical trials, and we're happy to bring that to this community.
Great information.